Evening, once again, every Wednesday, 8 p.m., you can put your pot on the fire. It's Your Health Matters, where we discuss a wide array of topics that should really be concern to you. And a lot of feedback from last week's program. And this week, we have another feature program where we're focusing on the subject of pain. Remember, we're going to talk a little bit with our guest, and we are going to open up the lines in case of any questions. Remember, 457-9997, WhatsApp, or a direct call. And we certainly hope that if you have any problem, or you know of anybody who has problems with chronic pain and you want to ask a question, you can ask that in this program. And so this evening, we are going to be talking about pain. And I've made up my face. I mean, you could understand my brows are frowned. My forehead is knitted because pain is one of those senses that is not so well understood. Do you know approximately 20% of the global adult population suffer from some sort of pain, whether it's acute pain or chronic pain? Can you imagine all the persons who are in conflict zone or so, or people who just step on some sharp object or so? And pain is a major, often undertreated public health crisis, I would put it that way, with prevalence reaching up to 34% in certain developing countries because they don't have the medication, don't have the techniques, they don't have the means of being able to treat pain. And when you think about it, in previous centuries, how did people used to handle pain, whether it was from a toothache or whether it was from an injury or an arrow or a spear going into you? How did you really handle things? And these are big issues, but chronic pain affects all populations and particularly impacting older adults, women, and those with lower incomes, causing severe distress. And despite the ubiquity of pain, I would say, the pain could be acute, sudden, and so forth. Acute, it could be chronic, or it could be intermittent. Something could be a combination of all these things. And what we're trying to do today is to bring some attention to the subject of pain. And I'm really proud of this one. I have with me a guest. His name is Dr. Kenneth Williams. And he was educated his former years here in St. Vincent Grenada. He's a Vincentian, and he did his went to medical school at Temple University in Philadelphia. He then did his further training at Albert Einstein Medical Center in Philadelphia. Then he did his residency in anesthesiology, right, at the University of Texas Health Center, where he has particularly focused on pain management, which many anesthesiologists do, but he basically has been able to pick up on a lot of very new techniques. And I must say he's a cousin of mine. He's a Thompson. Matter of fact, his mother, I want to say, was the first female from Chateaubriand to ever get a scholarship to attend the girls' high school. She became an accomplished head teacher, and she's no longer with us, but her kids, her five sons, her five sons, plus her daughter, Marjorie, they have now given a scholarship to one male and one female at the Chateaubriand Government School to be able to attend school in Kingstown and so forth. We're not here to really focus on that. And I really want to introduce, I gotta say, my cousin, a speed merchant. I mean, he used to hold, I don't know if he still holds a number of records in the 60 meters and the 100 meters at the grammar school. And so I'm sure by now those records have been erased. You know what I mean? But let me introduce Dr. Kenneth Williams, all the way in Texas. I know Texas is suffering from a freeze as what's going on in the United States. He is actually on call this evening, so you can see him in his scrubs and so forth. And I'm really pleased that he's been able to provide the time to be with us this evening. Dr. Williams, please, I don't know if you could give a little hello and so to the audience who are listening to you as well.
All right. Hello, everyone. How's everything going in St. Vincent?
Yes. Well, I know you were here recently for the family reunion, and yes. You have several kids who are also medical doctors too. Maybe you come from a medical doctor family, you know, and your older brother, your sister-in-law, a number of kids, and so that's quite remarkable. Yeah. But we're here to talk about the subject of pain, and I want you to tell us. You know, it might sound like a silly question in terms of what is pain, and why is it important? But as somebody who has specialized in this particular field, we're going to start simple, and we're going to build out around the subject of pain. But tell us, what is pain?
Well, pain is any unpleasant sensation that could be triggered by small injury or, you know, prolonged injury. Any discomfort that a person might feel is considered to be pain. It's important because it affects your lifestyle after that. Okay?
Yes.
So in cases of chronic pain, for example, every aspect of the lifestyle is affected. Your family is affected by it if you're in pain, and that's not a good situation.
Yes, you mentioned this word chronic, and then there's acute. What is the difference, and how important is that?
Well, acute pain is pain that you suffer from, like some unpleasant insult to your person, part of your body. Okay, that usually resolves with time, you know, under less than 3 months. Chronic pain persists after 3 months and becomes, you know, consistent and persistent, and like I said, it affects your lifestyle.
So most of the time when somebody has pain, it would be resolved in a week. You stop
right.
Somebody hit you with something, it heals, and after within 3 months it's supposed to resolve itself and heal. If it goes beyond 3 months, it's
considered chronic pain.
But I've known people to be suffering pain for not 3 months, not 3 years, but an extended period of time. And I want to get an idea, why does this happen where people suffer from chronic pain?
Well, there are a lot of different mechanisms, you know, and they understood, but the patient has to be diagnosed. First of all, you do an exam and diagnose the patient with the type of pain it is. Could be from a neuropathic pain, you know, from a nerve, or could be cancer pain. Could be, you know, these are the types of pain that could go on for a long, long time.
Yes, I get an impression that there are 4 big causes of pain, and they say cancer is one of them, as you mentioned.
Right.
Osteo and rheumatoid arthritis, maybe the other arthritis. Mm-hmm. Operation of, you know, and injuries, right? You know, and then spinal problems as a distinctive thing. I'm sure there are many more, but would you say these are the big 4, or could you identify any others?
No, those are the big 4, I'll say. And spinal pain especially is one of the biggest ones.
Yes. Now, from your experience, how do patients really handle pain? You were getting into it in terms of how it affects their lives and so forth. But why is it important to address pain? And should somebody be taking care of it by themselves, or should they be seeing somebody like you? I mean, actually, should they be getting some urgent help in this regard?
Well, let's focus in on spinal pain. These come from injuries, like work injuries. You fall and hurt yourself, or you develop some kind of pain in your neck, back pain. You really shouldn't treat yourself. You should seek help. Maybe go to a chiropractor or physical therapist initially, or even your own family doctor to help with diagnosis. And usually they will diagnose you by taking x-rays and give you medications, and you try that for a while, medications wouldn't work. So after you try medications and all these other things, your next step is you might be considering surgery as a possibility. But before you even get to surgery, you want to see the pain management specialist.
I see. Do you think that there's a rush to surgery on one hand? And do you think that too many people delay seeking good attention and try this and try that and try all kind of various things? Is that one of the reasons why it remains chronic pain?
Yes, because some people don't even know the existence of pain specialists, about the existence of pain specialists. So, like I said, they go to the family doctor, and traditionally they send them to a physical therapist who might or might not help. A chiropractor who might or might not help. And in the meantime, your injury persists. So you should be looking to come to a pain doctor for further evaluation at that point in time.
Now from what I've gathered, somebody takes a 2x4 and hits me on my arm, and it's likely to damage some of my muscles in my arm and cause some injury. On the other hand, there can be some sort of inflammation near some of my nerves, and the nerves could become inflamed as a result, and that could also cause pain. So there seems to be a type of pain in which nerves are damaged or cut or severed or something like that, and where other pains where the tissue is damaged or inflamed or so. Are those the main reasons why pain develops? That's what I'm trying to get at.
No. There could be some of the reasons, but they're not the main reasons. So the main reasons we talk about axial pain, pain in the skeleton itself. Okay? Could be in the neck or lower back or even in the thorax, which is the mid back. All right? And usually what would happen is that, there are these discs between your bones in the back. Act as cushions to, relieve all the stress of movement. And through these foramen on the sides of those, where these two bones come together, the nerves come out. So anything that could damage the disc, for example, would cause the nucleus to leak out or to impinge on the nerve itself, could create pain. So that's what we call like a herniated nucleus pulposus, which is the part of the vertebrae with all the spongy matter. That's what those are the main causes of pain in the back.
Mm-hmm. Okay. Now, a lot of people will be interested in how do you really treat pain and what is new in the treatment of pain. Let's first of all, how do you really address pain? Suppose I have pain in my back. I've been having pain in my back. It's chronic pain, and I decide to go to a doctor and so forth, how is that evaluated and how should it be treated?
Okay, so if you come in to see me, for example, you'll have to do an exam. We put you through an exam. Have you do some bending, see how far you could bend, what the degree of pain you have, and make an assessment what we think it is, and we send you to do an MRI of the back. Okay, the MRI will give a good picture of how the bones are lined up against each other, how the discs are lined up against each other, if there's any impingement of nerves in the foramen. And on that basis, we could make a decision.
That's interesting you say MRI. I suppose long ago, it used to be an X-ray, then it used to be a CAT scan. Now we go for an MRI.
Right.
Why an MRI?
Well, MRI is considered gold standard for assessing the muscles and all the tissues in the back.
I see.
Yeah.
But you might still have X-rays and so forth,
but you don't get as much information from the X-rays, like I said.
I see. So you don't waste time with getting a whole set of X-rays and so forth.
I said, well, by the time you get to me, you would have seen your primary care doc, your family doc. Yeah. He would have probably done X-rays. You've not gotten any information from it, but
Yes.
So by the time you get to me, the only thing left to do is the MRI.
Yes. Okay. Now, if the MRI shows that there are problems with your bones, your spine, there's herniated disc, all these some different kind of things, all these different conditions, what do you then do after that?
Well, in combination with the physical exam, okay, and the MRI information, you might think, well, the patient suffering from back pain as a result of herniation disc impinging on the nerves and creating that kind of pain. Now, there are a lot of people who have herniated discs who don't have back pain, all right? So the problem is when the disc herniate, there's a tear, usually that inflammatory materials leak out from the disc and impinge on the nerve. And that's what really, it causes inflammation in the nerve root itself. And that's what causes the pain.
Yeah. And so how is this treated? Is it you go straight to surgery or how is it done?
No, surgery is only 50-50, So a lot of people who have surgery still come back and have injections. So I'll suggest a course of epidural steroid injections.
This is where injections are placed into some targeted spots along your spine.
Right. Mm-hmm. Using sophisticated X-ray called fluoroscopy to guide us into the area.
I see.
And that's only one aspect of the back pain. You could have back pain also caused by facet arthropathy. Like the nerves that innervate the facet joints themselves, they might be inflamed. So we could also inject those nerves. This is called medial branch nerves. And all this is done under fluoroscopic guidance.
Yes. You
also have a sacroiliac joint in your low back also, right over your buttock. When I press on that, it's tender, that could be a source of your pain. Another thing is some people might have is coccydynia, which is tailbone pain. You
mean that's right down the last bone going down into your bottom there, right into
right by your butt peak, man.
What is your crack and so forth?
Right.
It's hard to use that word.
If you have any pain in that area, you have problems sitting, sit on a kind of donut type cushion and you'll be fine. But the best treatment for that is is an epidural steroid injection into that area to help it heal.
Yes. So what are they injecting? What are they actually injecting into these areas? How what's actually done?
Well, we inject a combination of local anesthetics and a steroid.
What's the difference? What's the difference there?
Well, a local anesthetic, they act by different mechanisms. You know, local anesthetics tend to pretty much numb nerves, and steroids, they reduce inflammation.
I see. I got to ask the question, how long are these likely to last? By getting that injection, does it go away and you're okay? You could get on your trampoline again, you could run a mile and so forth. What actually, how good are these things?
Well, I've had varied results from people. Some people, the pain goes away completely, 100%. Some people might get 70% relief on the first injection. Some people might get no relief, you know. And it varies, the whole spectrum. I could give you one example of a buddy of mine who I used to inject. He was having a severe back pain, incapacitating back pain, and he used to come by me. I injected him, and he got better. And he always tell the story to people. He got married again and had a baby. he talks about that at every function, you know.
Yes.
So it varies for different people, man. You know, the thing is, if these are benign injections, really, all right, it can't hurt you but trying them. But if you try them and it don't work for you, I guess the next step for you is a surgical approach.
Yes. Let me just shift a little bit here. We've been talking about the spine because I think as you identify, the spine is one of the big four. You know,
Right.
a lot of people. Now, suppose you are an elderly. You're not an elderly, but you're a lady who's about 60-something years old, and you start to develop arthritis. And this arthritis has been going on now for 6-7 years in your fingers and your elbow and your wrist, both wrists. How do you suggest something like this is handled?
Well, you could try oral steroids or NSAIDs, non-steroidal anti-inflammatory drugs, but they inflict a lot of damage on your other organs, you know. The non-steroidal anti-inflammatory drugs. So you don't want to use them too often, to take them too often. But arthritis, I mean, it's a complicated one because you don't want to inject every single joint, even though that could help. I
see. You talk about the medication, NSAID. A lot of people, ibuprofen is now used a lot like candy, right? Advil, and the other, what we call NSAID, the non-steroidal
anti-inflammatory drugs, yeah.
Medication.
Yeah, people have to be careful when they take them. They need to
okay, you don't seem to like them that much. You don't seem to like them that much, huh?
Not really.
Yes. What sort of side effects do we see as a result of them?
Well, if you take them too often, you could cause gastritis, which is irritation in your stomach that could lead to ulcers. You know, it could cause damage to the kidneys, mess up your kidney function. You know, so those are the two main ones.
Yes. Now, I know there's somebody who's posted a question here. I know this may be more in the area of physical therapy, but they say, good night, doctors. Can you give some tips as to how to manage lower back pain to make movement more manageable? Hope this question is intelligible. It is, yes. How I know this is more in the area of physical therapy, but from your recommendation, getting back to the area of back pain? How does how a lot of people are just left incapacitated, not able to move, they're bedridden, they're left in bed. Of course, relieving the pain is the critical element, but
Right.
what else could be done?
Well, physical therapy is an option, but doing physical therapy without seeing what the spine looks like, that could be a big problem.
Yes.
Because you may be doing more damage to your spine than good. Like if you attend to lean to one side, for example, and you have a bulging disc on that side, all you're doing is really putting pressure on the disc itself to cause more leakage of material onto the nerves. You understand what I'm saying?
Yes.
So that wouldn't help you.
Yes. Well, when I practiced in the United States as an internist, I made a bit of an error in that there were people who came with chronic pain, and I started putting them on a drug called fentanyl, right? And today,
A fentanyl patch?
the fentanyl patch, as well as fentanyl in other forms and so forth. And I used to slap on a Duragesic patch, and basically fentanyl today as an opioid, as a narcotic, when I started using it, was considered to be safe. I got to say that, right? And today in the United States, there's 106,000 people who die from overdoses and so forth of fentanyl. Whether these people originally had pain and so forth, what is the current thinking in relation to these stronger medications that persons may be inclined to take for pain? What's the thinking today? How do you address that?
Well, the people who die from fentanyl are not those that prescribe patches and things like that. These are people who take illegal fentanyl.
Yes.
They don't know the dosages and they don't have a means to reverse it, because if you had something to reverse the effect of fentanyl, when you take it, you wouldn't die.
Yeah.
And we use fentanyl in the operating room on a daily basis.
Yes.
As part of our induction technique, and also to treat pain while the patient's asleep. But fentanyl is safe as far as we're concerned. So number one, when you get an illegal amount of fentanyl, you don't know the dose that you're taking. You got them from an illegal source, and they tell you maybe 10 mags, 50 mags, but they don't know. You don't know.
Yes. But the addictive potential of an individual, even in the legal setting, you see a number of sports persons, sportsmen, sportswomen who got to get out there and play, and so they often play with some element of pain, and being able to relieve their pain. They might take medications that's not prescribed to them, but they also take what's prescribed to them. How is that?
I'm not sure what happens in the sports world, but most of those guys, could get fentanyl, well, not necessarily fentanyl, but medications prescribed to them by a physician.
Yes.
So they know the doses that they're taking. The problem is the fentanyl that you buy on the street, and nobody knows the concentration of fentanyl there.
Yes. When it comes to injuries in general, road traffic accidents, let's say somebody who's gotten into a head-on collision, and so very often you suffer from whiplash.
Right.
You see persons with neck pain and so forth. How really should the individual handle something like this? How should you handle it?
Well, a place I worked recently, we see a lot of those patients actually.
Yes.
Patients who were in motor vehicle accidents coming in with neck pain.
Yeah.
So
Le-
it's a whole different setup there.
Let's take a call here from somebody. Yes, Dave, how are you? Good evening. How are you? Are you listening? Hello? Dave?
Yes, good evening.
Yes, you're on.
Enjoy the program, Lee. So, but how do you balance off traditional medicine with conventional medicine? I'm talking when I say traditional medicine, medicine in terms of drinking this bush or that bush, and then, still taking conventional medicine. And when I say conventional medicine, what the doctors of the day will prescribe for you. I never got into any, I can, I know some of the local kibush and so on, but I know some people are very strong when it comes to traditional medicine. And they love to suggest to others who may be suffering from certain things. How do we balance that off from your professional standpoint?
Yes. Can you? Yes.
Well,
No?
if
Yes.
if it works for them, I'm in support of that. To be honest with you.
Yes. Dave, he said if it works for you, you be he would be in support of it. But what do you think? I think he was trying to get, is there any problem in using traditional herbs and so forth in addition to what you might prescribe all at the same time? Or should one be looking one or the other?
You probably should try one or the other so you could know which one works.
Yes.
All right.
Dave, you heard that? Hello, Dave?
Yes. Yes, I'm just trying to be clear on if anything. Well, I don't know from your medical standpoint, if you tell people what bush they can use in terms of traditional medicine, not to give any kind of interference with your regular modern medicine you may prescribe, because like I said, I know some people believe in the bush and so on. I am bombarded. I've been bombarded with, over the years, with people telling me to use this and telling me to use that. Thank God I've survived. I'm still around. I'm still alive. But I still wonder. Maybe there need to be to make things safe first. Maybe we need to have a list of bush that we can recommend to patients, especially locally speaking, all the local things that they tend to drink.
Well, let's hear Dr. Williams. What is your view?
I don't know a lot about bush medicine because I grew up when my father had a stroke back in 1976. Everybody came out of the bushes and recommended this and that for him, but nothing ever helped. So I'm not sure about bush medicine, but I could tell you about the things that I do.
Yes. Oh, yes. Well, Kenny, I straddle with both. I do believe in some aspect of bush medicine. Dave, I'm going to thank you very much for your call.
All right.
Thank you. Yes, I do believe these things as supplements and so forth and things like that, and they can help in some small ways. But I wanted to shift a little bit again. Now. a lot of people. Well, we have another call again. So let me just see. Let me take this
Yes.
other call. Hello, good evening. How are you?
Dr. Thompson, I'm fine, Doc. I'm fine.
Yes,
And I hope Dr. Williams is too.
yes.
Dr. Williams, since we're on the subject of pain, I want to ask you this. What kind of person is a person that feels absolutely no pain? I was listening to a BBC health program at time, and they say there are only about 4 or 5 people on the entire planet that don't feel pain. If they fall and break the foot, they will try to get up and walk again, not feeling the pain. If you put the hand in a fire and the hand will be roasting off, and you pull it away, they will push it back in again because they just don't feel pain. What kind of people are there? And I mean, why are they like that? That they just simply don't feel pain.
Kenny, you heard that?
I heard him. I know that people like that, but they're born in that with high tolerance for pain, very, very high tolerance of pain, just because of the way it's a physiological thing, nothing to do with the nerves, but that's the most I'm going to say about that.
Yeah, yes.
Anyway, thank you, Doc.
Yeah, Mr. Horn. In general, there are people who can have very high tolerance for pain. The persons, you pinch them, a very small pinch, and they will get on as if the world has been dropped on top of them. And then there are other individuals who will say they don't feel a thing. It will not go to the extent of what you have said, that they don't feel any pain at all, but their pain threshold is very high, and it takes a lot to actually trigger that. And there may be lots of reasons and so forth. We're not going to get into this program, but we know those particular difference. Yeah.
Dr. Thompson, let me see. When I was listening to that health program on the BBC, they say that there are about 4 or 5 people in the world like that. They had 1 in the States, 2 or 3 in Europe, and then about 1 or 2 in India.
Yeah.
And they say they're a special kind of person that you don't really you see one person like that in every maybe almost million persons. So I just was curious because Dr. Thompson, I think I had asked you this question before, and you gave an answer, but because we are now dealing with an anesthesiologist who deals with pain and that kind of thing, I thought maybe I should ask him to see if I could get any further comment on it.
We know the existence of those people, but you wouldn't come to me if you don't have pain,
Yes.
Oh, okay, now. All right, Dr. Thompson, see you on Monday morning, sir.
Thank you very much.
And thank you, Dr. Williams.
Yes.
Yeah, thank you, man.
This is something. Yeah, I mean, we're talking about tolerance, and so that people have not been able to understand. Babies, a mother delivering babies, and one mother is smiling, and the baby basically just pops out, and she's not having any sort of pain, and then what's that? Huh? Another question, huh? Yes, and and another person is crying and bawling and so forth. That's really peculiar, and it identifies the differences between us from one person to the other.
And for the person who feels the pain, we're here to help.
Yes. Wait, was another question you said?
Yes.
Where?
Yes, another question.
Where? Is that the same question here?
No, this is a different question.
Yes. Yes, okay. I thought this seemed like the same question. Good night, doctors. Having pain in the lower back, and when you put up your right hand and lean to the left, you feel the pain, but when you put up your left hand and lean to the right, the pain is less. So obviously this person is describing, we could make a diagnosis of where they actually having the pain. But you know, a lot of people will have these sort of complaints. What would you say to that, Ken?
Okay, well, a person deserves to have a physical exam done, because you really can't make a diagnosis just based on what was said there. You know, because if you lean to the left, she's leaning her neck to the left and her back to the left, or you know, is the neck straight when she leans, and you know, so I think that person deserves a physical exam because the source of pain could be either your neck or your low back.
Okay, let's take another call again. Hello, good evening. Can we take your call?
Good night, doctors. Good night.
Good night.
Yes, please. Mr. Thompson,
Yes.
since I took the COVID vaccine,
Yeah.
all my joints them still hurting me. What do you think I should do? I will listen off air.
Okay. Kenny, that's a big one there.
Was that COVID vaccine?
She took the COVID vaccine, and since she is taking it, all her joints have been affecting her and so forth.
Okay, so which COVID vaccine did she take? One from AstraZeneca, from you know?
Yes, I'm not really sure. We didn't get a chance to ask her. She went off her line. But tell us your views. I mean, I have my views there too, but I'm curious as to what.
Well, I really I've taken the COVID vaccine too.
Yeah.
And I've known people who were part of the experimental process in developing this vaccine. Even before it became a vaccine, people who were used as guinea pigs to develop the vaccine, and they've been fine. So it's difficult for me to say, well, you know, I mean, there might be other things. I mean, you know, it deserves investigation pretty much.
Well, I'll tell you, sir, you know, what she probably didn't say is whether, even though she took the vaccine, whether she got COVID, and whether the COVID is what's one of the side effects of what they call long COVID,
right,
is having chronic pain, having chronic fatigue, and so forth. Those things of that nature, you know. But today we are meant to think that if we cross the road and a car tries to knock us down, it's because of the vaccine.
Right. So that's why I say it deserves investigation.
Yes. Further
investigation.
Now, there's an interesting question. You and I spoke about this earlier on this evening. I know what you might say already. Can Doc say if he knows or has looked at prescribing cannabis products for pain management?
Well, like, I'm not really an expert on that. You might be a better expert on cannabis than I am.
Yeah.
You know? So I know a lot of people, but I don't know a lot of people. I know people who use cannabis to dull some pain. And it tends to be more like cancer pain, you know, rather than like neuropathic type of pain.
Yes. Okay, this is an interesting one. It is often said that women have a higher threshold for pain than men. In Dr. Williams' experience, is this true? I don't know if this question is coming from a man or coming from a woman. I do not know.
It doesn't matter, man. It's true. No.
It's true. Yes.
Listen, empirically, I could tell you, you know, the reaction of guys versus girls. You know, women don't. Guys really afraid of pain. They have a low tolerance of pain.
Yes. But in terms of your management or doctors, let me not say you specifically, but doctors' management of pain, the people with higher threshold, people with lower threshold. I mean, how do you take this into consideration? The larger dose you have to give and the risk of addiction and dependency on the medication and how long it might take for the, how do you address that?
I tend not to prescribe too much pain medication. My techniques involve more interventional, pain management, which is injections of steroids and local anesthetics. So
What's new? What's new in pain management? When I practiced in the United States, a company came by and gave me this TENS unit. This is an electronic device. I would strap on the thing over the area of the pain and it would send electrical pulses to that area of the body. I didn't find it work that well. You know what I mean? These electrical stimulation of the area of the skin or the other part. What is new in pain management? I just say you focus a lot on more the injection of steroids and other chemicals into a specific area, joint, the back, and so forth, to get the relief that you basically are looking for. And you've also said that somebody who had 100% pain, that their pain level has dropped to 70%, is smiling. Because even though it's 70%, the reduction is so important for them, right? But from the standpoint, I'm looking at a comment, you comment on that, and also what's new.
Well, that's why pain management is so important, because it's really management of your pain. So if you suffer from pain, and we talk about people who are suffering from chronic pain, been living with pain for a long, long time. And you bring them in and you give them one treatment and they got a reduction in pain. That's significant for them, especially in a couple situation, for example, because the guy's pain affects everything, whether it's female or male, You can't love your partner the way you used to because it's overwhelmed by pain. All right. So any kind of reduction that could bring you closer together is significant.
Yes. And then in the subject of what's new and on the horizon in relation to pain management?
Well, there are a bunch of experimental things, like for example, PRP treatments.
Well, we'd like to know the abbreviations. What's that mean?
Or platelet-rich plasma. That's where you take some blood off, you spit it down, get platelets, and inject it into the joints.
Wow. I want you to repeat that again for me. Platelet-rich plasma. PRP.
Yeah.
This is where you're able to get some blood.
Platelets from yourself.
Your own self.
Yeah.
So there's no danger there of getting blood from somebody else.
Right.
It's yourself. And then they're taking out the red blood, taking out the white blood cells, and they're leaving just platelets. And they're making it, they're concentrating that.
Yeah.
And they're re-injecting that into your blood or into the joint or what?
Into the joints.
Yes.
Whether it's in the spine or your knees or, elbows, ankles, wherever.
What's been the experience with that?
Well, this anesthesiologist I worked with had me inject her one time, and she seemed to be she said she felt a lot better after that.
Yes.
Just empirical,
Yes. Anything else that's new? I mean, that sounds big, strange, but big.
There might be other things out there that I'm not familiar with right now.
Yes. In terms of getting back to a particular subject, we touched on it in terms of cannabis and traditional medicines and so on. I know, Texas is not one of those states that has legalized even medical. Well, I think medical cannabis is legalized there, isn't it? But certainly not recreational and so on.
Right.
Yeah. But do you see, in terms of as people age, and they're going from their 60s to the 70s and so, how, and this is going as a kind of a general question, but how can, what should they be doing so as to helping to prevent injury? Injury will cause pain. What can they do to help strengthen their muscles, to prevent falls? What can they do to really do a lot of other things to keep being as fit as possible? Which may be going against the grain, but really, I think this may be a subject that really helps, and some of the persons who will be listening may be looking for answers to these kind of questions.
I think just stay active, you know.
Active.
Yeah, just stay active and do your stretch exercises, your yoga, you know, that sort of stuff.
That's really important, because we now live in a generation where we're sitting down in front of a couch, looking at television, looking at, so it's really sedentary, and
sedentary lifestyle.
And we're putting on weight at the same time that puts stresses on these particular joints and so. The subject of cancer, one of the big four, and pain management is, you know, before you were talking about the spine and the injections and so forth. How do you handle pain when it comes to cancer? But cancer's now spread to muscle and bone and all this other stuff. How do you handle that?
Well, pretty much with narcotics.
Yes. It's a matter of just relieving the pain
just
at the time.
Yeah. Comfort measures.
Yes. And in terms of, you say you don't engage a lot of sports medicine as such. How about young individuals? Do we see young persons also suffering from chronic pain, or is this something that's the purview of the elderly, of persons who are older? You know what I mean?
We see people of all ages. You know, usually they will suffer from they will be part of a motor vehicle accident. Right.
Yes.
And they got injured during that process, and pain extends just like everybody else for a long period of time.
You know, or riding some sort of bike or scooter or something of that nature, which was, you could say is a motor vehicle accident as well. But
whiplash injury, you know, and they got herniated disc in the neck, and it's pretty debilitating for them.
Yes.
You know, another type of pain that a lot of people have is what we call myofascial pain. Just a pain in the muscle itself.
Yes.
Especially in the trapezius area, the shoulders, you know, neck muscles. And the way diagnosis is when you press on those areas, people want to jump out there and scream just by touching them.
Yes.
Those are called trigger points.
Yes.
So the way we break up those trigger points is by doing trigger point injections.
Again, so where those trigger points are, somebody touch, you touch a person, the person will jump out of their chair.
Triggers a reaction. You want to jump out from your seat, you know.
And just injecting in those areas, careful, very small needles and so.
Yeah.
Do you, as we come in the program, do you believe in? I know I was going to touch on a series of this in between cannabis, but let me touch on acupuncture. You know,
trigger points is like acupuncture?
Huh?
Trigger points is like acupuncture.
I see.
Okay, because you go in those areas and you inject them and you break them up. Acupuncture is what we call dry needling.
Yes.
What trigger points is we actually inject something into those trigger points.
Dr. Williams, I'm hoping one day you'll be able to come to St. Vincent and run some sort of clinic, right? Where these people can be evaluated. There's an MRI here and so forth. And I think that this can be an important area for many people's life. Because chronic pain leads to depression.
Yes.
It leads to disruption in people's life. It could even lead to suicide.
Suicide, yeah.
You know? And resolving it is so critical. And we've gone into a lot of details. I wanted to focus on some of the big four, the spine, cancer, arthritis, that particular type of pain.
Yeah.
You are, I know you are a true Vincentian, you know, and I want to thank you very much. I mean, I last week I was featuring another Dr. Thompson. And you're Dr. Williams, but I consider you as Dr. Thompson Williams. I put it that way. And, you know, really proud of some of the work you're doing. And so you've been a great inspiration to me and so forth and things like that over the years. And
Likewise, man.
And I want to thank you very much for coming on to the program and sharing a bit of your knowledge. It's a simple thing. So you hear the questions. People want to know, well, what about this? What about that? You know, I raised my arm, I raised my leg. What could this be? And so forth. And I'm hoping that they can go to their local physician and get some of these answers, you know?
Yeah. It's amazing. Some of those problems are easy problems to solve, you know? So, you know,
just the last thing. There was somebody who that we can ponder on. They say, is it you use injection for pain management, use of pain management permanent, or does the effect of the injection wear off after a while?
It will wear off after a while, or it could be permanent.
Yes.
You know, like for the trigger point injections, when you inject them, it stays around for like a couple of hours, but it breaks up the trigger point. So next time you come back for a visit, you're going to have fewer and fewer trigger points until they all disappear, for example.
Yes.
With the epidural steroid injections, they could last for a while, for a long time, forever. Some people, like I said, they don't last any time, and somewhere in between. But if they don't work for you, then you have to figure out the next step in your process. What's your next step? And surgery might be your next step. Who knows?
Yes, yes. Dr. William, we're really proud of you as a Vincentian, as a Black individual, even in the United States, and wish you all the very best. You know, thank you for coming. I know you're on call. I'm sure your phone has been buzzing and so forth like that. And do have a wonderful rest of the evening. And give my regards to all members of your family.
All right. Thank you, man.
All the best.
All the best to you and the people of St. Vincent.
They're great. Wonderful. Bye.
All right.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m.